Don't make these questions too difficult, Mike.
Oh, we have no idea where we're going to go. So be honest. The first time you skied, how many times did you fall?
I didn't.
You didn't?
But I've only done the bunny hill.
I mean,
I have good balance.
you are way ahead of the game if you didn't fall the first time out. Hello and welcome to Off Script. Here at Oswego Health, we love to take you behind the scenes with the healthcare team that takes care of you. And today, very excited to have Michelle Burns with us today. Michelle, thank you so much for coming on Off Script.
Thank you for inviting me, Mike. It's good to be here.
Absolutely. So here's how this is going to go. You and I are on a chairlift about to get off.
Okay.
So we'll start with a nice easy green circle. And on the way down, we could hit a blue square, maybe even end up on a double black diamond. Are you ready to roll?
I'm a little bit nervous, Mike, because I'm more of a bunny hill kind of person, but let's do it. Let's do it.
The way I was taught is jump right in, and double black diamonds is where we went. Okay. So you ready to go?
Yes, I'm ready.
Right. As you can tell, we'll start off with some ski talk. Okay. And I know we share that hobby together.
Yes.
I know that you're newer to skiing. Yes. I need to know, first, what got you involved? I got to know about your first day on skis.
So honestly, it's the kids that got me involved. So I have 3 children. 2 of them really got into skiing last year, and they begged me to try. And of course I said no, because I was afraid I would fall down and break a hip, but they insisted that I could do it. So, but I've only done the bunny hill so far because I need to get a little more courage, which I know I can. The first day, they laughed at me a lot, mostly because I went to Woods Valley in Rome, and they had this really nice, I don't even know what you call it, but you get your skis on it and it brings you right up the hill.
Oh, the magic carpet.
The magic carpet,
those are the best. You slide right up.
It's the best, but I will tell you that when I first started going on the magic carpet, I thought I was going to fall there too. So I'm screaming and the kids are yelling at me, "You're going to be fine, just hold still." So the first day was a little hectic.
I have to say, getting off the magic carpet is a lot more difficult than it looks. It's a little shaky with getting off.
Yeah, it is.
And you do it for the second time.
You feel like you're going to fall forward.
Yeah.
So they laughed at me an awful lot, and it took me a while even to go down the bunny hill. I was staying at the top of the bunny hill saying, I can't do it. I'm going to fall. And they cheered me on. My husband did too. And I went down and it was fun. And then I realized I could do something that I have never done before.
The beginner trails at Woods Valley are actually pretty good.
That's what I've heard.
Woods Valley is a great place. Yeah.
I'll get courage to do more than just the bunny hill, because it is a lot of fun. And it gives you something to do with the family in the cold and on the winter days when there's not much sunshine and we're always in the house. We get to do something as a family, and it is a lot of fun. So I will admit.
You opened up a door that I really want to go through. We're talking about weather. Central New York. What do we always talk about? The weather, right? So you being a Central New Yorker, I'd like to know what keeps you here in Central New York? Because you've lifelong, grown up, always living in Phoenix.
Yeah, it's where my roots are. All of my family is here. So don't get me wrong, I love warm, sunny weather down south, but I guess that's better to go and vacation there, enjoy your time, and then come back home where your friends and family are.
Awesome. Since being a lifelong resident of Phoenix, New York, which makes you a true Central New Yorker, what's it like growing up in this area?
Phoenix is very small. It's a very tight-knit community, and it's safe. It feels very safe. I was there. I grew up as a child throughout Phoenix. I moved to Liverpool for a very short time, went back to the Phoenix area when we had our children, and that's where they've grown up. And I think as a parent, you get a different view on just how safe the community is. It's a very nice area. They do a lot of family activities in the summer. There's always kinds of festivals going on along the water. Great school district.
I remember I used to play youth basketball at Phoenix.
You did?
Grew up in Cicero, but we'd always play in Phoenix. They had a really great league set up really well. And I'll never forget, even now, till today, driving through Phoenix, you cannot drive through Phoenix without seeing a village police officer. So when you talk
Oh,
about
yeah.
safety, absolutely.
Oh, and they're
Yeah.
great.
Yeah.
They're very involved. In fact, our now police chief is still actively involved within the school system. I believe, hopefully I'm not saying this wrong, but I believe he came out of retirement to take over as chief, but he was very active in our schools as one of the resource officers. So all the kids know him.
Oh,
So it's nice to have
awesome. Yeah.
friendly faces out there patrolling the streets.
Cool.
It's very safe.
So I understand your family has a camp in the Adirondacks. So how long has that been a part of your family?
So we actually have two.
Two?
So the one in Old Forge, that one is a family camp. So there's a few families involved and we all kind of pitch in to care for that. And then the one that's primarily ours with my husband and his sisters, that one is in a place called Wanakena, New
Gotta
York.
tell me where that is.
So that is, have you heard of Star Lake, Cranberry
Star
Lake?
Lake,
Okay,
yes,
it's
yes.
up in that direction.
Mm-hmm.
And that's been in the family for over 20 years. The Old Forage one, that's been in the multiple families for decades and generations, I should say. But the one in Wanakena, that we've had that in the family for about 20 years. It's wonderful. It's right on the water. We do all of our kayaking there, our stand-up paddleboarding. Lots of work, because owning a place means a lot of work.
You get up
It's
there
great.
quite often in the summertime?
We try to. This past summer, we had a lot of things going on within our family. Close family members had a lot of health issues, and so we didn't get up there as much this past summer, but hopefully this summer we're back on track because we do try to get up there a lot.
Next time you go to a camp in Old Forge, you got to stop at my favorite store.
What
Life
is
is
it?
good.
Oh, yeah.
That store is the best. I love that store. It's the
It
best.
is. It
if
is.
you're in a bad mood or a good mood, it'll always get you in a good mood. by the
Yeah,
time
I
you get
remember
it.
when they put that store in, I was very excited to
I
see
love
that
that
coming
store.
to
It's
the
the
town.
only. It's there in Lake Placid. The only ones I
Yeah.
know in New York. I'm sure there's more, but the only ones I know of. So fantastic. So what is a perfect day up at your family camp?
Just spending time as a family. We've made so many memories over the years with family members that have, aged over the years. And you think back to all those days that, I mean, everybody's up there, aunts, uncles, cousins, and it's just the memories made. We do fun things like big breakfasts. So everyone does their part to make this huge breakfast buffet. And it's a lot of fun, just making memories.
What's on the buffet?
Oh gosh, you name
The
it.
foodie in me, I gotta ask.
You name it. Anything on a breakfast menu, somebody's making.
Pancakes, I'm sure.
Of course.
All right,
Oh, of
blueberry
course.
pancakes.
Oh yeah.
I'm
yeah.
in. I'm in. I'll find my way there. Yeah. So I want to talk a little bit about your healthcare journey because you have a really cool one. To me, it's awesome.
Yeah, is it cool to you?
Yeah, absolutely. The ability, the growth to me is just, it stands out. So you've been a registered nurse since 2005, bringing more than 2 decades of clinical experience. So what first inspired you to pursue healthcare?
Well, I was in high school, and it was my senior year, and I had some extra time on my hands because I didn't need as many classes to graduate, and I wanted to fill that time. And there was this amazing program through Oswego County BOCES.
Oh,
That's what they
yeah.
called back then. So I decided, you know what? I think I'm interested in healthcare. I think I might like something like that. Let's try it out. So I went to the CNA program and I absolutely loved it. We did a lot of clinical within local nursing homes and I just fell in love with it. So when I graduated high school, that's what I did. I worked as a CNA for about a year or so in a local nursing home while going to Onondaga County BOCES, OCM BOCES, to get my LPN because I knew I wanted to do more. I knew I loved what I was doing and I wanted to continue on and, serve more. So then I went on that track. So I did get my LPN and I started at St. Joe's Hospital and they have an amazing RN program. They have an amazing College of Nursing. And the opportunity was there for me to continue on and that's exactly what I did. I think I just loved it from the start. Like I knew that I wanted to do something in healthcare. And when I was a senior and I did that program, I knew it was my passion. Like I just kept following it through.
That's great.
Yeah.
Do you have any memories when you were first a CNA? Any memories that you still think about today?
Oh, I do. I do.
You gotta give me one. Yeah.
I hold some of those people near and dear to my heart. In fact, when I stopped working there, I would return and visit and bring Christmas presents. And it was just so much fun. But I did have one, oh gosh, I have so many different residents there. Do you know you know the movie The Birds, Alfred Hitchcock?
Oh, yes.
Okay.
Yeah.
So I had one resident in this particular nursing home every night faithfully. Now I was young, I was only 18. Every night faithfully, that man watched the birds on his television as we would get him ready for bed and get him tucked in for the night. Every night. So whenever I see that movie or hear of it, I automatically think of that gentleman.
The biggest memory I have of the birds is we were at Universal Studios. They had a 3D viewing of the birds. Oh, it was awesome. So the birds came out at you.
Was it kind of
Oh,
scary?
it was intense. It was awesome. It was great. It was fantastic. Alfred Hitchcock at its best. It was great. It was great.
Oh, he loved it.
Yeah.
And he was fun to talk to this particular resident. He had just so many great stories, and he actually had polio, so he would share those stories of what he went through. So, but yeah, so many residents I'll always remember.
Travel nursing. You did a little of that too, right?
I did.
So at one point you also worked in travel as a travel nurse. What inspired you to take that path?
So I had talked about travel nursing for a very long time, and this was before people knew what travel nursing was. So this is way before the pandemic when everyone heard about travel nursing.
Oh, yeah.
And so I would pick some of the nurses' brains that were travel nurses at the hospitals that I would work at, and it sounded so interesting. And I know I couldn't go far away. I couldn't go to other states. I had, my children and my husband, but it would be neat to see other parts of New York State and other regions.
Central New York's the best though, right?
Yeah. And that's pretty much where I've done all my travel.
As long as we
nursing.
agree on that.
Yeah. But anyway, so I had curiosity in it and started talking to some recruiters and said, oh, maybe I will give this a try, just to see what else there is out there. And local travel nursing, meaning Rochester, Binghamton, Utica, a few different ones in Rochester, Watertown. So yeah, not too far away, but still the experience that I gained is incredible. And I've met so many people.
And then the journey continues because you did work on the medical surge floor. So tell me a little about that. Yeah.
So I've done med surge my entire career. So that's about 25 years of med surge nursing. Now, most people, they'll do maybe med surge for 1 year because it's wild and crazy and a big mix of everything. It's like a hurricane of anything medical you can think of. But I've learned a lot. I've learned so much, and traveling to different hospitals and doing float pools within Syracuse area hospitals, you see so much. You become very well-rounded.
See, that's
very well-rounded.
We went exactly where I wanted to go.
Yes.
Tell me about, so having the ability, so from Central New York, got your training here in Central New York, but then you did have the ability to work outside of here. So being able to now come to Oswego Health and take what you learned, what advantages do you think that gives you now?
I think the fact that I'm very well-rounded. I've seen so much. I've seen, and it's interesting with working in different parts of Central New York, because even in the different regions, things are a little different, and how it's very interesting. But it really opens your mind to all possibilities, and I think it helps me be a better provider in that I've seen so much. I've seen how things can be different. Everything isn't one way, nothing's textbook, and each situation can be dealt with a little differently,
Absolutely. Why Oswego Health?
So I actually worked at Oswego Health for a very short time as an RN back when I was doing travel, and I liked it here. But it was short-lived. And then when I started looking for a job in the nurse practitioner pathway, I did see an opening with Oswego Health, and it had mentioned that there would be a new office opening in Northern Onondaga. So originally I thought, wow, location, that's incredible.
Couldn't be any better. Yeah.
That's incredible. And I know I've worked there a little bit and I liked it. It's close to home. It's very community-like, very family environment within the hospital when I worked here. I said, okay, well, maybe it's meant to be. So I interviewed for it, and I automatically had an interest. I'm like, this might be where I can see myself. And I think the biggest thing was once I completed one part of the interview, we did a tour of all the primary care sites. And that was eye-opening. That was like a no-brainer. When you talk to all the staff, everyone is so happy with working for Oswego Health. Everyone has great stories to tell. And they love their work-life balance. And you could just see it. Like everyone was truly happy working for Oswego Health. So I I knew then I think this is the right fit for me.
Fantastic. So you've worked acute care, hospital settings, outpatient care, and then community-based care. What ultimately drew you to primary care?
I kind of see primary care similar to med surg, which is what I've always done.
Oh.
Because med surg is a little bit of everything, like I had mentioned, and primary care essentially is too. I mean, I guess if you could compare it, you're kind of like the orchestra and the band. So you're orchestrating someone's health care, and you might reach out to this specialist or this specialist, but it all kind of comes back. You're the primary provider for this patient. So I like that aspect of it. And same thing with med-surg nursing. I learned so much. I saw everything. I wasn't just doing one specialty and only knew that one specialty. For example, like maybe neurology, and then I only knew everything about neuro patients. I learned a lot, and I feel like primary care is similar, where if you work in primary care, you're going to see and learn everything. And then I'll continue to be that well-rounded practitioner.
Absolutely. I always, my sister, she's a physician in Texas, primary care. Whenever I see her, I always tell her, I go, it's got to be the hardest. It has to be, because you have to know a little bit about everything.
And that's what I want.
Yeah.
I want that type of a job. I always keep my brain moving, always learning.
New patient to Oswego Health, their first appointment with you, what are they going to expect?
Well, first, they're going to get my smile, because you got to start with a smile. Smiling is good for the soul, and it changes the entire environment. But as their provider, they need to know that they're going to have someone that is basically going to be their team member. Like, we're going to work together for you, for your health. That includes, awareness, educating, knowing your preventative measures, and managing what you currently have. And we're going to do it in a way that's non-biased and confidential and comfortable. Like, I want patients to feel comfortable when they're with me, that they can just be themselves, and that no question's a bad question. And that not only do I want to teach you and educate you, but I know that I'm going to learn from you. You're going to be teaching me a little bit.
For anybody who doesn't have a primary care provider, explain to them what the importance is of having one.
I think that the importance of having a primary provider is to essentially taking care of your health. You want to live, everyone wants to live longer, right? And many patients out there don't have a primary care provider, so things are missed. For example, I recently had a patient and no primary care provider, but no symptoms, but his blood pressure's through the roof. So there's things that are missed if you don't have a primary care provider to go to.
What excites you most about caring for patients at Oswego Health?
Getting to know them and becoming essentially part of their lives. Like I said, we're going to be a partner. So I think it's really important to have that relationship where you truly know your patient, because then your patients can truly feel that trust and truly open up to you. And when they can open up to you, there could be things that they didn't want to speak about, or feelings that they felt that they weren't going to share. As long as they have that trust, they can open up to you and you can work through it. It could, there could be something going on. And if they didn't speak up about it, it could be missed.
I have to say, Michelle, we've gone on some green circles. We hit a couple blue squares, right? We went over some moguls, but I think you made it all the way through some black diamonds.
Okay.
Since you did that, and congratulations to you, right?
Oh, thank you.
You get to graduate to rapid fire questions.
Oh boy,
Are you ready for these rapid fire questions?
Let's see.
We're
gonna find out.
They're all super hard. Let me know when you're ready.
All right, go.
Okay, cool. True New Yorker, Central New Yorker question. Snowstorm or heat wave?
Oh boy. I like the heat because we have a pool and I love to swim in the pool. However, snowstorm is what we always get, so I have to accept the snowstorm.
Oh, we agree on that one. I do love when you're flying back in from down south or wherever you're coming from. You fly over Central New York. I'm probably wrong, but it seems like there's more pools per capita of homes
Yeah.
than anywhere else
But
in the
you only
country.
get to use it for like a month or two.
You gotta get in that pool when you can. Favorite Central New York restaurant?
Oh boy. So this isn't a very good rapid fire answer because we don't go out to eat very often. We do a lot at home, but can I tell you my favorite dish at home?
Yeah.
Well, my husband, he actually makes this. He bakes his grandmother's top secret recipe of homemade mac and cheese. And I can't tell you too much about it because it is a top secret recipe, but I will tell you that we have to go to a special cheese store to get the cheese.
What store? Or is that too top secret too?
It's a store up north. That's as much as I can say.
I think I know what that store is. River Rat Cheese, maybe?
Yeah, we do. We've gone there. Yes.
Okay.
Yes.
So it's not that store. I'll figure that out.
But we don't go out to eat too often. We're very
If
busy.
you were to go out though,
yeah.
where would you go?
I don't know. We really don't go out too often. Do you have any suggestions? There's your rapid fire question.
Oh, for me?
Yeah.
I mean,
suggestions if we want to go out.
I'm a huge fan of the Craftsman.
Okay.
My wife and I go there all the time. I love steak, so that's steakhouse. That's
okay.
awesome. And then out in Skinny Atlas, I love why am I drawing a blank on it? A place that I absolutely love. Rosalie's.
Okay.
Italian food, I love it there. So yeah, those are my...
We have a nice little local restaurant in Phoenix that's very good. Dusky's. Have you heard of Dusky's?
Yes, I have. Yep.
Yes.
Yep. And
that's
a lot of
close
friends
enough to home where if we have time, we can go there.
You never answered this in the beginning, so I'm throwing it back into the rapid fire questions. So, and I'll give you my true answer too.
All right.
So be honest. The first time you skied, how many times did you fall?
I didn't.
You didn't?
But I've only done the bunny hill. Should I be falling on the bunny hill?
I mean,
I have good balance.
You are way ahead of the game if you didn't fall the first time out.
I didn't.
I went to Killington with my wife. We were on trails by the name of Easy Street. I lost count actually at 25 times.
Oh
right?
my gosh.
And then she was yelling at me,
But
pizza,
you got back up.
French fries,
yes.
pizza, French fries. And I yelled back at her. And then I fell, hit my head. And then the ski instructor came by and goes, does he need help? My wife goes, just keep going. It was great. It was great. Yeah. I made one turn that probably wasn't a real turn, but it felt good. So I go, this is skiing. I'm skiing. Yeah. Yeah.
If I were to do like the actual trails amount, I probably would fall. But I do have very good balance.
That's the key of the whole thing. So you're ahead of the game.
Yeah.
Ahead of the game. Harder skill to learn. Skiing or learning an EMR?
Skiing.
We didn't talk about this, but I want to bring it up after this question. Answer this question. Is there a destination that's still on your bucket list? I know you love to travel.
My husband just mentioned one. We would love to go to Croatia. But we've been to so many different places, and there's one that always stays in my heart, and I would love to go back because we've been there a few times, and that's Paris.
Oh, yeah. It's my wife's favorite place to go. Yep.
Pretty much ever since we had our children, we haven't really flown across seas. So it's been a while.
On the lake. So a lake day.
Okay.
Are you kayaking, swimming, or just relaxing on the dock?
Kayaking. Yeah.
It was cool because you said that already. Yeah.
I have a stand-up paddleboard too. Have you ever done that?
No, when I see people do it, I'm like, it's not for me.
I have good balance. I've never fallen on that either.
See, you're going to be a great skier. You're a great skier. So you graduated to that. So I asked you to bring in a couple items.
Yes.
That, signify who you are. It's the first thing is, I call it the box of treasures. So we'll open this up. Oh.
Literally, it's a treasure box.
I feel like I'm on QVC. So tell me about this lovely box.
So this is a box of just some of my medical antiques. Some of my treasures that I have found antiquing.
What is in...
So that is a bottle of medication. Look, it's still in there. And they would use this for children for bedwetting.
Really?
Yes.
Oh, fantastic.
Yes. And so some of these are empty pill containers, and some still have some tablets or pills in them. But we have some other really neat things too. Those are actually postcards.
Oswego Hospital. How about that?
Yeah. Should we put this on the table?
Oh, yeah.
So, and this is really neat. This one is postmarked 1916.
Yeah.
Oswego Hospital. In the back of this, you can read the writing. It's actually talking about a baby that was sick with an intestinal infection.
Oh, I
Yeah.
hope she got better.
She did. She
Oh, she
says
did?
here, yeah, she says
Fantastic.
here that she is getting
At
better.
Oswego Hospital, right
At
there.
Oswego
Right there.
Hospital, 1916,
Yeah.
right? And this one's a little older. This one is postmarked 1913. And this says Oswego Hospital and Nurse's Home.
Whoa.
This was talking about something to do with her ear pain. It's very interesting.
She got better too, I'm sure.
I know she did. She was being treated at Oswego Hospital. She
This
definitely
book
did.
to me is amazing. You could probably still use this. The
Yes.
nurse's pronunciation dictionary. This is amazing. It's so
Isn't
cool.
it so cool? What's the
It's
year
so
on this
cool.
one? I think it was.
This
And there's some
thing-
advertisements in here too.
There is Bailey's new midwife's case. Look at that thing.
An advertisement for Nurse's Cap. We used to wear the caps.
Gotta have that.
So we do a lot of
That's
antiquing
old.
in Bouckville. That's a big antique festival.
Love
and,
me some Bouckville.
And
You haggle?
Adamstown, Pennsylvania.
You haggle with anybody at Bouckville?
Not over the top. It just depends on what the item is.
I always go. I'm looking for the brass fire extinguishers. We turn them into
Oh,
lamps.
yes.
I haggle for those.
Oh, that's
I don't
so
always
fun.
win. No, I don't always win. I think it's a hip.
So this is one of the sockets for hip replacement. When I worked at a hospital in Rochester, they learned that I collected a lot of medical antiques, and they offered me that. It's heavy, isn't it?
Yeah. This is wicked cool. Yeah. So you went through the gauntlet of all my questions. So it's now time for you to feel free to ask me a question. If you like, you can feel the power of the question asking by holding these cards while you ask.
All right, let's see. So you have many jobs. You have a lot of titles, don't you?
One would say.
So I know that you work, is it for Cicero Volunteer Fire Department?
Yes.
So you have
Yep.
so you have a passion to help others.
Mhm.
You have that calling. And you have the love of skiing.
Oh, absolute passion. My wife started that animal. Yeah, love it.
So
Love it.
have you ever thought of the idea of mixing those two together and becoming ski patrol and helping those on the mountain that are in need of your assistance?
It's crossed my mind. I would love to do it. There's a lot of sliding back and forth in backwards skiing
Okay.
that I don't do. So those
Backwards
are things that I
skiing,
need
oh,
to.
wow.
And the biggest thing I really want to do for ski patrol, my dream would be to rescue someone off of a gondola, right?
Didn't that just happen?
It happened in Gore, yeah.
Is that what gave you the idea?
No, it's just something
Okay.
I always do. I always ski with, when I go to bigger mountains, I always bring carabiners and rope.
Just because you're
Just in
prepared.
case. I'll be that guy.
So
Off-duty
just
firefighter, yeah.
Okay, I
Rescues
love
people
it.
off lift, yeah.
Okay.
Yeah. Michelle, thank you so much for coming on Off Script with me today.
Thank you for having me.
Absolute honor. This has been fantastic.
It's been a lot of fun.
This has been Off Script with Oswego Health. We'll see you on our next episode.